CBT means cognitive behavioural therapy, and it's one of the most evidence-based therapies through research to show it's very effective for working with a number of conditions like people who've experienced post-traumatic stress disorder. What it actually means is it's a way of the cognitive is the thoughts and the behaviour is how we might behave in response to thoughts we have. So it's the idea that your thoughts and feelings and behaviour can all interact and affect each other. And if you change one of them, for example, you work on responding differently, a different behaviour, it can affect your thoughts and feelings. If you work on what are you're thinking about a particular situation that might be upsetting, by changing those thoughts, you can change how you behave. It works with children and with adults. We specialise with working with children and young people. When someone has experienced a traumatic situation, it can be that the thoughts and the meanings they experienced at the time of the trauma can often be quite negative. There's often feelings attached like guilt and shame and anger. And so there's lots of feelings, and people sometimes cope by avoiding thinking or talking or anything to do with the trauma. Unfortunately, that avoidance can really keep the experiences of those thoughts and feelings going and can make them feel very scared as if the trauma is still happening. And so this approach really targets some of those thoughts, feelings and behaviours. So it's really very much working with some of those difficult thoughts and meanings they might have experienced at the time or after the trauma. And it's really looking at some of those emotions, those strong emotions they might have experienced, and really also working with some of those behaviours like the avoidance. And in kind of working with those different things, we really find that people can get a lot better.